I just wanted to get your reactions on the concern raised by Speaker Chalahi and all the other senators after the said hearing.
Sure. If you tell me specifics, I can tell you. I think part of it, I think there is a law in place that says we have to put a large number of data, more than any jurisdiction in the entire world. The entire world. Guam is supposed to post on the website. I'll give you an example. That law requires that if a physician worked for 1 year in 1972 on Guam and had a drunk driving charge when he was in high school, he would be dead. He had died 50 years ago. We have to hunt that down and put it on the website. So when they say, oh, only 50 or 60 people have been posted, I think the people of Guam need to understand that questions sometimes come into, can you be too careful? And if you're requiring, and I will say that the Federation of State Medical Boards, which governs all boards, said that this is impossible. And if it were possible, then the amount of money that would be needed to collect all that data. For example, we're supposed to check, it doesn't tell us how often, but every single jurisdiction in the entire world for any restraining orders on any physician currently or previously licensed on Guam. Now, you may want to know if your physician has committed a significant offense, but we do have something called the National Practitioner Data Bank that allows for people to query and see if their doctor has a significant issue against them. One thing would be that you can check to see if your doctor has had any money paid out on his or her behalf. That's the law, that be reported to this data bank. So I'm going to comply with the law to the best of our ability as a board. It's not I think some people also think that the physicians who are on the board somehow are scouring the internet for these offenses, some of which may be serious and some of which are very minor offenses that occurred 50 years ago. It doesn't matter. Still supposed to be there. And so when they criticize the extraordinarily hardworking people who work in the administration of the Health Professional Licensing Office, I think they should look at the law again and say, is the Federation of State Medical Boards wrong in telling them that it's a bad law, right? The intent of having people be able to look to see if their physician has committed a crime in the past, I think people understand that, right? But I also would say, you need to start to think a little bit about that. It means that someone who retired 50 years ago, we're expending money on that, but is that really what you want? A retired physician who has died? You want to have the government of Guam spend money posting that on a website? It also goes to something that all of the physicians have been complaining about. The speaker and other healthcare providers have been complaining about her not helping us, right? And that's part of, I think, the frustration that we have. So for example, we look at this and say, do people want to come to Guam if they had a drunk driving accident in high school and she wants that posted on drunk driving charge in high school, and they wants that posted on the website? We would be the only ones in the country, I believe the world, that I haven't found another site that posts drunk driving from high school or accusations, right, that have been in there. If someone filed something, it's supposed to be there. And I'm not the one that makes that judgment. I think the Federation of State Medical Boards has said that's a little much to do. You don't do that for teachers. You don't do it for policemen. You can't go to the GPD and say, who was the police officer that arrested me? I want to see if he got a charge of drunk driving in high school. It's not posted on the GPD website, but that person could be out there and being a police officer, and rightly so. I don't think the judges on Guam, that you have a website that'll say, let me see if they have any convictions, if they were ever charged with something when they were in high school, right? Or retired judges, do we have that, right? Or judges who died, we want to embarrass their family and put that up there for what purpose? I don't know. That being said, I think it was a bit harsh of her to attack the administrators. It's not the board, the administrative people who are short-staffed working to put those data up there, to get angry at them and criticize them publicly, I think is a bit harsh on the government of Guam employees who are trying their best during the pandemic. And even some are out getting called to help do testing or help find other, do contact tracing many of them were doing so that they can, then they come back and do their job. I think they're doing a great job. I think they work very hard. Some of them have had personal, they're short staffed, and some of them still had personal tragedies in their family, of which the speaker is aware. And so I think it's a bit harsh to attack them when they're trying to do something that the national board that governs all of the medical boards has said is impossible to do or would cost an enormous amount of money. The example, like I said, is one that's a little too harsh. So I would say a couple of things. That the board members work very hard. We have to make decisions that are very difficult. We count on the administrative staff, and yet they're overburdened and doing work that I think is not particularly beneficial to the public, while the work of gathering all the information and presenting to us as quickly as possible so we can assign investigators. And by the way, doing our own investigations is a very difficult thing for physicians to do too. We would like to have an investigator, somebody who can do the investigations and present them to the board, rather than having physicians who aren't trained to be investigators doing the investigation. So I think that it's a political thing. We're trying to do the best we can with the resources that we have. We're all volunteers. That's why I sort of just go let her put on her political show. And then we go back and try to do the hard work day in and day out without nitpicking at the things that we are unable to do for lack of resources. I think it's a bit harsh. We're trying our best. We are all physicians who are approved by the legislature, and for good reason. They're hardworking healthcare providers. Or in the case of the member of the public who is volunteering his time and is a senior member in the business community who helps us to try to keep things organized and develop budgets and work with the legislature. It's really, and yet we can't come out and defend ourselves. I can't sit there and discuss cases that are still under investigation. So I don't really have that opportunity to do it. But I think you're asking me, and I'm kind of saying, there is more to the story to this as to why we are being attacked by the speaker and Senator Teitigui. There's a lot more to the story, and people need to understand that we're not going to do other than try to do our best every day, day in and day out, to protect the welfare of those who seek healthcare providers on Guam.
All right, thank you for that, Dr. Berg. So I also did want to ask, because we have residents and people who live on island, and so how would you respond to those people who say that the GBME is effectively protecting doctors from complaints or shielding them from being held accountable?
It's never been our job our job isn't, if you look at the task of the Guam Board of Medical Examiners, it doesn't say to protect doctors, it says to protect the public. And we deny people's licenses if we feel that they would endanger the public. We have physicians who we feel need additional training before they are allowed to practice on Guam. We've made all those decisions. I think that people need to understand that when you look at malpractice lawsuits, there are 80%, in some states it's as high as 80% of all surgeons and obstetricians have been sued. So that a lawsuit, or if you're in the field of plastic surgery or other high risk procedures, to have 3 or 4 lawsuits is not unusual at all. Settlements are often paid without the physician wanting to pay it. The insurance companies will say, no, we're going to settle because it's cheaper to pay it than to defend it. The physician's malpractice insurance always says that the insurance company can do that. So we very carefully look at every lawsuit to see if it looks like there's something that is significant enough that that person should not be practicing on Guam. You have to understand that the people who are applying have licenses in other states. And so if cases are resolved in the state that did the investigation of whatever the allegation is, remember, these are reported and states investigate them. If they do the investigation and feel that that person is still a good physician, even though he or she may have made a mistake, as a physician, which can lead to malpractice lawsuits. We can't get rid of 80% of physicians because they've had lawsuits. There are perfectly good physicians who may have had lawsuits early in their career. There are physicians who over a 30-year career may have had a few. It doesn't mean that they're unqualified doctors. And I think that exaggeration, I think the speaker knows that, as does Tello Taitigui. They know that very well. Some of our legislators have gone to the Philippines. The Philippines does not let you know. There is no ability for you to walk in and say, have you been sued? Versus in Guam, you can't. So you can see if you think that someone having been sued very early on in their career or for a mistake or something that they say they didn't do, but were part of a big lawsuit and the money was paid out on the behalf of the hospital, but each person that's named in a lawsuit that person gets named, all of that we scrutinize. And we have had people who have had such egregious lawsuits that we said, no, that person should not, we're not going to allow that person to practice in this community. But it's all of those decisions are made on a case-by-case basis with multiple physicians looking at these records and discussing them. If you look at the minutes of the Guam Board of Medical Examiners, very frequently you will see after a very long and thorough discussion, then we decide either to not allow someone to practice or to practice. These decisions are never easy. I liken it in some ways to a parole board where you're trying to judge whether the behavior of somebody who may have made a mistake or had an error, whether that person is safe to bring back into the community. It's not an exact comparison, but you're trying to look to see people who have made mistakes who still don't have to be restricted from being in the community. For us, we look and see if someone made a mistake or might have made a mistake. Are they still good physicians? And if he or she is a good physician and the records would show that, then I guess we all kind of decide, is that somebody that we would take our family to? And if we felt that that would be a safe person to see, then we say, yes, that person can come. Do we get it right every time? Parole boards don't. And we can make mistakes, but we do our best. We go overboard in trying to investigate things and decide whether or not the person should be able to practice. Not an easy decision ever, right? Restricting somebody from practice restricts a healthcare provider being able to provide care to you, me, or our family on Guam. So you also have to balance that, right? If this is a good person, a good provider, you have to say, well, if we're going to say no, then we don't have that specialty on Guam. And that's not outweighed by any chance, by any measure, that's not outweighed by safety concerns. It's a balance, right? So it's not an easy job, and it's why we have an extremely difficult time recruiting people to be on the board. You want qualified, experienced people to be on the board, and many see what are deemed by most as political attacks, and they don't want to be in that firing line. So I think that if people came and saw what we did as individuals in the board and how we practice in the community and how we don't want bad doctors here either, our families are here, maybe they would see that there is a genuine other side of the story that is just as important. I don't mind getting scrutinized by the legislature. I don't mind that. That's part of what we know is going to happen. It's just one has to be fair and be cordial and nice and not attack, but rather collect data. Don't look for, things to bring to the media the next day of, oh, it's only 50 people were in the system. Yeah, that's because we have to go back to 1972 and look for drunk driving accidents of people who died 30, 40 years ago and see if we can find it in their high school yearbook. I'm not sure. So those attacks, looking for reasons to attack, I think is a bad way to approach healthcare.
Thank you for your thoughts, Dr. Berg. And I guess for my last question regarding this whole topic is, what letter grade would you give the GBME, relative to?
I don't think that I would say you can give a grade to somebody. I think it's an ongoing process. And I would say certainly we meet as a quorum. Even during the pandemic, we had very few times that we weren't there as a quorum, that there's participation of members of the board that is very high. And I'd say we have highly qualified people who care. So from that standpoint, I think we're doing an excellent job. I don't think that a grade is appropriate. I don't think any board could be graded overall. I think as long as you have hardworking people who are striving to always do better, we're definitely not doing perfect jobs. Nobody's getting, 100%. If you want to go percentage wise, nobody's getting 100%, but we'll constantly strive. How about I could tell you, we're constantly striving to get an A+, right? Do we hit that mark? Not every time, but we have a record of trying our best and doing our best, right? So that's all I hope that people expect of us, is for us to do our best for the community and know that we live here too. And if I go to the emergency room at Guam Hospital, I may get a doctor that we passed as allowing to be able to practice on Guam, because it might be me who needs to see that doctor. That's real. That's very different than, say, if you lived in Los Angeles, where the odds of that happening are low. The odds of that happening here, if you go to the hospital, high, especially when we have very few specialists. It's very high that my family, your family, my neighbor, my friends, my coworkers are going to need to see that person too. So the thing I would say is we strive for an A+, we do our best.
Thank you, Dr. Berg. Lastly, is there anything more you would further like to add or share about all of the stuff we talked about, from lifting restrictions to, this whole topic?
I think that in the spirit of coming through the pandemic together as a community, and I would say even as a healthcare community, whether you're the chair of a healthcare committee or you're a physician in the community, for Guam's there are so many good things about Guam, but what I always feel best is, what is the best part about Guam, is that we come together as a community. And I think it's been a struggle to get through the pandemic, and we can come together and work towards always making our community better and better. The next tragedy is coming, right? Whether it's a typhoon or some financial crisis that hits us. But as long as we work together and don't attack one another and say, how can I help you, right? As long as we're out there saying that's the positive component of Guam, is how do I help you? Not attacking one another, not splitting and dividing, but coming together. I hope that as we come out of the pandemic, that'll be a turning point where we can come together and work together in all aspects of healthcare and public health for our community, and making sure we don't leave people behind as well.
Thank you for that, Dr. Berg. I guess that's it for this weekly meeting with you.
Thank you very much, Shane. I appreciate the opportunity.